I'm going to check for those who are making noise and you don't take it personally.
You don't have to leave. I'm on mute. I
Just
can't.
checking. It's great to see so many people volunteering, interested in global research. I'm excited. I need the help too. I was working on a PowerPoint of the different opportunities available to all of you, and I realize now why I'm so tired all the time. I got too much work to do. I'm getting noise from one person so far. I can't figure who it is though. Okay, I think we're good. So greetings, I'm Professor Ronald Donald, clinical psychologist and DBH faculty. And I've been doing global research for about 10 years now, consultation and research. And we'll spend the first half of the meeting, I'll do a very brief introduction, then spend about a half hour just doing brief introductions from all of you. And then I'll spend the latter hour going over a set of slides outlining the opportunities and finishing up with what you can all do for next steps to take advantage of the opportunities. I'll prioritize them. I'll make clear the pathways. I'll ask for volunteers along the way for some help on certain things. So let's just dive right in. My background, as a clinical psychologist, my career is really, before I came to ASU about 13 years ago, was in the private sector, working for mostly managed care organizations that owned clinical staff model sites. I was a clinician and director of many behavioral health sites. And I shifted my career working for health plans in New England, leading disease management programs and behavioral health programs. And then I was recruited for ASU to lead as director of the Doctor of Behavioral Health program when it was formed back in 2008. And it was because of my background as both a clinician and manager, I really got the opportunity to do that. And I spent a year running up the curriculum that you're all going through right now. So this is 13 years ago, and we certainly tweaked it and enhanced it, but the basic core courses remain the same, and I'm really happy about that experience. It was a crazy year. It's been very gratifying seeing all of you come through the program since then. In terms of international work, back in 2010, I was at a conference in Los Angeles, and a psychologist walked up to me from Hong Kong, and he saw our DBH brochure. This would be a great program for China. There's a great need for this kind of curriculum. So I got ASU's approval to go for 2 visits with a small team, another couple of faculty, a project manager who was a ASU student who was Chinese, could translate for me. And we went to, with a partner we met in Beijing and kind of barnstormed to universities, hospitals, and we spent about 6 months, with that effort. Later on, we tried to establish some collaboration with the university in China. And in the end, those things just didn't pan out. In part, at that time, online education was seen as a negative in China. In-person was still preferred. ASU, the DBH, as you all know, is expensive. And for those students who had the income in China, they would go to the top tier schools. Other students couldn't afford the DBH. So a different dean at that time said they really need to pull the plug. And I said, well, I understand there's no ROI. I said, do you mind if I continue with my contacts as a consultant in my own company and just continue doing physician, nurse training, education? I'll be going to conferences and promoting ASU. And I got the okay to do that. ASU has been very good about supporting faculty doing entrepreneurial work. So I spent literally the last 10 years with a business partner in Beijing, going to China about typically 4 or 5 times a year, each time for 10 to 15 days, doing a combination of training, a lot of conference presentations, marketing meetings, trying to get more training opportunities. And that's been going very well. It's on hold now because of COVID, but that's been a great opportunity for me. And then over the course of time, just through networking, I began to meet many other colleagues in conferences throughout Southeast Asia. And I learned about an ASU USAID program that really sends our students out to study abroad for 3 or 4 months. And in 2017, we got approved to begin sending our students abroad, between 3 and 5 students each year, typically in the summer. And I used my contacts I established in China and Southeast Asia to send students there. And we did a research study I'll go over in my PowerPoint slides, but that's been an ongoing program. We have 3 students now who are doing this remotely because of COVID-19, but it's been a great source of research for us and data. And I've also applied for some small ASU grants, and my goal is to apply for larger national grants to do work globally. So there's opportunities for all the above. And I want to just stop there and have a chance to have all of you just kind of say it maybe 2 minutes, your introduction, your background, whether it's clinical or management interest, and what brings you to this group. What's your interest in global research? And try and keep it brief. We have a lot of students to go through. So I'll just name off names to make it simple. I'll start with Jessica to go off first. Jessica Hernandez.
Yes, sir. Hi, I'm Jessica. I live in Purcell, Oklahoma, and I am a therapist here in the mostly rural area. I also do behavioral assessments for a lot of the small schools around Purcell area. This is my first semester in the DBH program, and so far it's been going pretty well. And my master's degree is in social work, so I'm an LCSW, and undergraduate is in psychology. So I've always had an interest in mental health. I've also done a lot of research during my master's program. We did some research with different immigrant groups in the Dallas area. We went and talked to them about things that they are experiencing as immigrants, and worked to help get them resources and things like that. And I also did some research with human trafficking, specifically on the Texas, well, I guess all the South borders coming in, and the different groups that are around those areas to help victims of human trafficking. So.
Great. Welcome. And I'm
Thank
gonna have to keep it more brief, 1 or 2 minutes, because we have so many people on. We'll spend an hour and a half just doing introductions.
Oh, I'm sorry.
No worries, Jessica.
Sorry.
So just for everybody going next. And I'm gonna have my DBH graduate and colleague Jen Rolfe go next.
Hi, I'm Jen Rolfes. Many of you probably know me. I'll try to be really quick. I have a bit of a different background than a lot of people in the program, in that I am a statistician by training. My initial work was in biostatistics, focusing on patient quality of life and cost effectiveness of competing treatment protocols. I spent 8.5 years at T-Mobile in the digital technology space, which seems like a bit of a detour, but what that taught me was how to wrangle data and deal with some really significant data quality, data validation, and disparate data problems. I most recently became the Chief Data and Research Officer for a nonprofit called Cornerstone Whole Healthcare Organization. For any of you who know Jen Y, I won't even try to pronounce her last name, and you'll understand why if you know her. She's the CEO of that organization, and I met her in the DBH program. So we're both recent graduates, and I do a lot of work around opiate use disorder, suicide risk, and really just helping rural clinics who don't have technology and data resources, kind of understand their populations, and also where they can make the most meaningful difference. So that's me in a nutshell. I came on board this project originally 3 years ago, I think, to really help with data analytics for all of the different teams that were overseas on the USAID grants. And I'll be quiet now.
Thanks, Jen.
And I'll be back in like 20 minutes. I got to go get my kitty.
Great. Nina?
My name's Nina Russin. This is my second year in the DBH program. I have a completely different background. I came to this program from journalism. I worked as a journalist for 30 years, including 10 years as columnist for the Chicago Sun-Times. When I retired from that, I decided to go into healthcare because I've been a athlete for many, many years. And so I got a job as a corrective exercise trainer here in Phoenix. I'm particularly interested in lifestyle interventions and how those can be used to combat chronic disease globally.
Thank you. Douglas?
Hi, everyone. My name is Douglas Gitari Mucheke. I'm born and raised in Kenya, moved to United States like in 2001. So I have two homes. I call US my home and I call Kenya, Africa my home. My background is health science preclinical. I do have a bachelor's degree in health science preclinical, master's in healthcare informatics, and I am, this is my first year in DBH management, and I'm very excited to be part of this team tonight. Why I feel that a call for me to be in this program is actually overdue is I have so much passion to volunteer and serve the underpopulations within the global world. I do partner with like 2 or 3 hospitals back in Kenya in terms of the rural maternal and child mortality rates and HIV. I do help where necessary, but I feel that a call for this program is in the right direction. I want to be out there and help people enhance their lives, come up with interventions that will enhance humanity.
Great. Thank you, Douglas. Abigail?
Hello, everyone. I'm not feeling too well today. My name is Abigail Matthew. I am towards the end of the DBH program management track. I'm currently doing my internship and the CP2 course. I've been interested in being a part of this program since I took global health, and this was, when I started the program. I am actually also the CEO and founder of a telehealth organization that integrates social services, medical, and behavioral health services. This program actually was derived from a paper I did for Dr. O'Donnell's class. It was a telehealth project, and I ended up as an entrepreneur taking that and building upon it. And now our program is up and running. So we offer services through HRA, but when people are coming for housing, they're getting the medical services and the behavioral health services they need to help them throughout the process. I've also just presented at the 2020 Ryan White Conference. Our project was the 5-step approach to patient engagement for patients living with HIV and AIDS, and this included the formerly incarcerated population. And I'm very interested in taking my research to another level.
Great. Thanks, Abigail. How about Jennifer Stanga next?
Sorry, I know it says dance. My daughter changed her name and I have no idea how to fix it. My background, I'll be really quick. I got a bachelor's in psychology. I got a master's in secondary mathematics. So a big jump from a lot of the typical programs. Then I got my MSW at University of Denver. I worked as an RA and published 2 articles during that time, including Medicaid expansion and adoption agencies and zip codes. And I pride myself as a math nerd. And so, because I taught math for 7 years, and from grades 5 to 11, I stopped and I taught college algebra and stats. And so I'm really familiar. My MSW class, I had to teach my class how to use SPSS and what statistical data meant. So that was a nice little break from the social work world that I had for a second. I have 2 kids. I'm a military wife. I just moved to Florida from Utah a few weeks ago. I love research. I'm still working with my other professor too, because we're finishing our publication, and I'm excited to join the team.
Great. Thank you. Ashley Capps.
Hey everybody, I'm Ashley. I am a clinical behavioral health student, and I live in Florida, in Destin, Florida, which, if you don't know where that is, that's where all the hurricanes come. We have one coming in a couple of days, it looks like. I work as a clinical mental health therapist. I have my own private practice here in Destin. I am about halfway through the DBH program, and I start my internship in the spring. The doctor I'm working with is actually from Pakistan, and he has a charity organization over there he works really closely with to help underprivileged children with healthcare and education and that kind of thing. So I thought this would kind of be a nice springboard to, I don't know what direction, it would take, but I'm very interested in helping with that. And I'm planning on going with him when he visits there on the next visit, probably next summer. So anyway, that's me.
Great, thank you. How about Britt next? ERITT?
Yes, hi. My name is Brittany Stewart. I am halfway through the DBH program as well. I started my career in public health about 6 years ago, working with the Georgia Department of Public Health. I literally walked into a clinic and said, how can I help? And I was navigated to a health educator. And from there, we've worked on health education and promotion. And so my main focus now is integrated care with our teen health clinic. And so that is my focus, that is my passion. I got my bachelor's in business management and a master's in public health, environmental health. And so now I am working on my doctorate as well, so.
Great, thank you. Carmeletta.
Hi, I'm Carmelita Hilton. I am from Iowa. I'm in Des Moines. I'm in my second semester of the DBH program, the management track. For the last 8 years now, I have been working with adults with intellectual disabilities, primarily residential, but it does get more healthcare when you work with your more medically fragile people. I was really interested when I looked at the offer of this program because of the develop and implement the train the trainer one. I have done a lot of training, and it is probably the part of my jobs that I usually enjoy the most, is getting to spend that time with people and develop their skills.
Fantastic. Thanks, Carmeletta. The label is crystal clear on the.
Hi, my name is Crystal Carmichael. My background is in clinical psychology. My undergrad was in psychology, and I am a licensed clinical mental health counselor. And this is my first semester in the DBH program. I also have a private practice, and I haven't been involved in a whole lot of research since my master's program, where I focused on the disparities in healthcare for African American women. And so I'm interested in getting back involved in the research process by joining this group.
Great. Thanks, Crystal. Christina Clark.
Hello, everyone. I am actually in my last semester of the DBH program, so I am super excited. And yeah, exactly. So I was actually a USAID Global Development Research Fellow last summer, not this past summer, but the one before in Vietnam. And so I am very interested in global work, and obviously, and really enjoyed my work there. And I've been a part of this research team for, I guess this will be my second year now. So I'm looking forward to working with you all.
Great, thank you. Christina Medeiros.
Hi, this is also my last semester. I am a certified family life educator and I'm a behavior analyst, so data is my thing. I work primarily in pediatrics and family dynamics. I do remote parent training right now for underserved populations that are in rural areas, and I'm in LA. So we have a lot of research here on cross-cultural adoption. And the doctor that I work under, that's his specialty. He is from South Africa, and we work with families that are adopting internationally to help sort of ease the transition. And so I just like research and data, so here I am.
Great, we need that. Douglas Pachecki.
I already did my
Sorry.
introduction. Thank you.
Dr. Angela Wadi.
Hello, sorry, I had to step away for a few minutes. My name is Angela Wadi, and my background, I'm a licensed clinical social worker. I graduated from the DBH program in 2014, and Dr. O'Donnell was my advisor. My background, I've mostly worked in my career in the military, the Department of Defense, and the VA, and I'm also an active duty military spouse. I've traveled the world, and I'm really interested in international social work.
Thanks, Angela. Florence Njoyi.
Yeah, I'm Florence Njoyi. I'm in Minnesota, and I think I'm almost like 3/4 done with my DBH program. I'm current USAID fellow. We're fortunate to be working on a couple of projects for the Southeast Asia, but unfortunately that we cannot go there because of COVID-19. So probably let's cross our fingers so that we can be able to have that international experience. I'm interested in international research because I come from Africa, specifically Cameroon, where basically we need research to be able to design intervention that could actually help population in so many things. I'm interested in comorbid diabetes and substance use. Currently, I do work with MND. MND is mentally ill and dangerous, committed to do mental health treatment with the state of Minnesota, LICSW.
Thank you, Florence. And just for those who didn't catch it, we have 3 students now who are USAID doing work, and Florence is one of them. So thanks for your help, Florence. Heather Dorn Deasy.
Hi, I'm Heather, and I live in the Pacific Northwest in a very rural area. I have a background in applied behavior analysis. I'm a board certified behavior analyst, and I operate 2 clinics providing services to kids with autism, one in Boston and one out here. My interest really, I'm starting the DBH program, so I'm really enjoying it and geeking out, but my interest really as a business owner is developing and implementing systems to make clinics run more efficiently. I also really enjoy the training component and making staff feel more comfortable and more competent. I just really love research and data, and that's my jam. So that's a little bit about me. I'm also a mom of 5, and yeah, thanks.
Fantastic, Heather. Thank you. Yi Ting, I'm glad you made it.
Thank you. I'm actually outside, so I have my mask on. So a little bit about me. I was a psychiatric nurse maybe 30 years ago, and then obtained biochemistry degree from Columbia University, and then got another master for computer information system. Been working in the research field for 25 years, from personal care to food and supplement. Because I just couldn't stand in the regular traditional lab. Recently received my second patent using cosmetic ingredients to come up with a wound dressing. So it just got approved after 3 years of work. I also have set up a company to transfer a medical device that we developed since 2015 into a medical field. So I've been in the research front for so long and glad to help in this process. And congratulations, Jen, for your achievement.
Thanks, Yi Ting. Jonathan Liu.
Hi, good evening, everyone. My name is John. I'm an active duty soldier. I manage a small cross-functional team that's operated in United Asia and various other parts of the world. My background, education DS in clinical health sciences. I have a Master of Public Health with a focus on health communication. and got interested in the DBH because of the particular vulnerabilities of PTSD within my community in the military. As far as my experience in Asia, I did do some work with USAID before in the past. I was involved in a research protocol researching violence against women and girls in the conflict setting. So interested in that, but also interested as well as in anything integrated behavioral health. Glad to be aboard.
Great, thank you. Kate, go Patrick.
I currently live in Missouri. Originally from Poland. I graduated from DBH program like 3-4 years ago, and I currently run a program for correctional population in Springfield, Missouri. And I'm rejoining the group. I did some work with Dr. O'Donnell last year, well, a few months ago, for the previous edition, and I really enjoyed it, so decided to come back.
Great, welcome back. Katrina Trubella.
Hi, good afternoon. My name is Katrina, and this is my first year in the DBH program, and my background is in mental health. And then prior to coming to the DBH program, I completed medical school and then decided I was too old and too tired to do residency. And I really wanted a program that focused in on the third leg of the triple aim on the quality improvement process. So I thought the DBH program was more what I wanted to do. My background is in military. I am a veteran as well as a military spouse. So I spent most of my adult life traveling overseas and living overseas as a daughter of a military person. So most of my interest has been in international healthcare. I also have been a volunteer for Doctors Without Borders since 2012. So I've spent a lot of time working overseas. So I would like to continue that once I finish the program.
Great, thank you. Kim Cobbler.
Hi, I live in Salt Lake City, Utah, and my background is in software development. I recently just retired from that role. Was a manager of a lot of different development teams, but right when I retired, my last role there was a product owner of a data product. So I have a lot of passion around data, healthcare data, and process improvement. I was a Six Sigma Black Belt while I was there. And I recently just transitioned into life coaching, which I love. It's my passion. I'm very passionate about prevention. And I use a lot of energy healing modalities like EFT and chakra balancing and a lot of Middle Eastern kind of principles in my life coaching. And I coach people all over the world. So I have clients in Jerusalem, Switzerland, Canada, Australia, India. And I love that about coaching because I'm not a licensed professional. So I know that's a little bit of heresy, but anyway, that's a great opportunity for me.
Great, thank you. Christy Supwish.
Hi, I'm a licensed clinical social worker and a licensed independent substance abuse counselor in Arizona. I actually work right now for ASU in their counseling services department for the students. I've spent several years up at Mayo Clinic in their primary care doing integrated behavioral health, and then also down at Gila River, which is a Native American community as well, doing integrated behavioral health down there. And so this was a natural fit. And just again, thanks to Dr. Mackey for kind of giving that nudge and answering some questions I had. I'm in my first semester of DBH right now. Super interested in just a lot of the exposure of different research. Very interested. I taught for 10 years for the School of Social Work as well. So I'm very interested in the curriculum and the training for the social workers in India. So I'm just happy to be here and looking forward to working with the team.
Great, thank you. Pearl.
Yes, good night. It's actually 9 o'clock here in Augusta, Georgia area. I'm originally from the Virgin Islands, St. Croix. I'm currently a sub-investigator, senior clinical coordinator. Our site, I have worked with NIH and the National Cancer Institute in Bethesda. I've also worked at the Department of Health and Safety as well over there. I worked for actually Rosenthal, if you know, Rosenthal seasonal affective disorder, one of the main people in behavioral health, which I'm very proud of. I decided to do the behavioral program because I wanted to fulfill my my goal of, you know, having that doctor behind my name as well. I'm also a prior service Army medic, doing emergency medicine. Let's see here. My background is biology, organizational management, my master's in health administration. I'm also, our site at my job is also currently doing a COVID prophylactic trial right now. So that's quite interesting. And the BSL level has changed for us. So we have to be a little bit more mindful of it at work. And I'm looking forward to this. So thank you.
Thank you, Pearl. Ramona.
Hi, everyone. I'm from Pennsylvania. My background is in health administration. I have my bachelor's and master's in health administration. I've worked in a few different sectors of the field. I've been a long-term care administrator. I've worked in health information management, hospital administration, a few different areas. I kind of realized at one point in time that I wanted to have the potential of teaching at some point in the future. So I decided to go back to school for my doctorate. I did a pretty extensive search of programs, and I really just thought that the DBH program was really impactful. And I have a strong interest in behavioral health, and that's what I did my master's thesis on as well. So I thought it would be a good fit, and I actually currently work for ASU as a writing specialist.
Fantastic. I'm biased. You made the right choice, though, to DBH.
Yes, I think I did too.
Russ Silverberg.
Hello. Currently teaching with the DBH degree on the clinical side of the internship class. I got my master's in counseling a couple hundred years ago, and this just sort of seemed like a good natural progression. I'm also not very good at impromptu speeches. The end.
Thanks, Russ. Xiyu Wu.
Hello, everyone. I'm Shiyu Wu. I got my BSW from Beijing, and then I got my Master of Social Work from Hong Kong, and then I obtained my social work PhD from UNC Chapel Hill. So all my backgrounds are about social work. I'm glad to see so many teams have social work background. So I'm currently the social work assistant professor at ASU, and I'm also working with Dr. O'Donnell on several projects, including the South Asian USAID project, and we are also working on several publications and applying the grants. And my research interests include the social determinants of health and health disparities, locally, nationally, and internationally. And I also interested in social work in integrated healthcare and looking at how we can involve the integrated healthcare and provide better services. Yeah. But, thanks for joining.
Last year. Yes, we've been colleagues for a couple of years now.
Yeah.
Johnson.
Hi, so my name is Susan Johnson. I am in the management track, and my background is in performance improvement, compliance, and accreditation. My husband happens to be the managing director of behavioral health at CARF, so I've had the opportunity to travel with him internationally several times. He's done work for the UN in Vienna and Singapore and Thailand and Rotterdam. So that has sort of sparked my interest in the international global health. So when I got this email, I was super excited. And I'm just willing to volunteer for whatever, because it's awesome to me. So thanks.
Thank you. Tony Cole.
Good evening, everyone. I am in my second year, couple of semesters away from getting my DBH. And when I finished undergraduate, I was interested in going in the Peace Corps. You know, I wanted to, travel internationally. Didn't know what I wanted to do, but I wanted to do something. So I've always been interested in cultural. I was actually thinking about enrolling in a cultural anthropology class, but I ended up in social work. So I'm a licensed clinical social worker. I'm a business owner. I work for the federal government as well. And Dr. O'Donnell had me really interested in international healthcare after taking his global class. And I told him, I said, next time you go to China, I'm with you. So when this opportunity popped up, I jumped on it. So, I mean, with health informatics, just how seamless it is now for processes, and I don't know, it's just a seamless, the walls are down. So how do we, what are our shared values? What are we doing alike? What are we doing different? And I'm really interested in developing curriculum as well. So that's a little bit about me. Thank you. I'm honored to be on this panel with this committee with so many, you guys got it going on. I was like, oh my God, do I have anything to say? Okay, so nice meeting everyone.
Thanks, Tony. Racy.
Hi, everyone. My name's Racy. I'm based in Las Vegas, Nevada. I am a management concentration in the DBH program. And prior to this, I earned a master's degree in thanatology, which is pretty much the study of death and dying and suicidology. But I'm really, really excited for this group, particularly because I used to work with an international team in telehealth. And so when I saw this opportunity to, contribute to international research, I was just absolutely hyped. So I'm looking forward to working with everyone.
Thank you. Dr. Muhammad Abdallah.
Can you hear me?
Yep.
Excellent. How's everyone doing today?
Good.
Great. Well, I'm delighted to join you guys. I've been managing the International Development Project with the United States Agency for International Development for 5 years right now. And we've connected early on with Dr. Donald. I got my doctorate in behavioral health. I've enjoyed behavioral health ever since I've been working in East African HIV prevention and prevention methodology using behavioral health. And that proceeded in Dr. Donald and I expanding our USAID project towards Southeast Asia. We used to work in Indonesia, Philippines, and we continue to work with those folks, but not specifically in the realm of integrated behavioral health. We worked on other infectious diseases. Right now, with the GDL program in its 5-year existence, we have sent abroad 87 scholars, selected, vetted, and completely funded by USAID and other international development organizations, other local donors. And it's been an incredible program. We've seen the growth both in our host partner institutions as well as our students who, when they first came to ASU, expected to just go through these courses and take as much credit as possible, but yet not interact internationally with our host partners. We were able to send them abroad and have them work with our partners, set the scene for the research, make sure that the IRBs and everything are well taken care of, and the connection is right and established between the host partner and the scholar. And we monitored them and made sure that the goals and objectives are being met, and that we're staying true to our global health objectives, especially with respect to the Sustainable Development Goals and goal number 3 of the SDGs, So far, as I mentioned, we have had 90 USAID GDR scholars. We've sent people to 28 countries and impacted and contributed to all the 17 Sustainable Development Goals. We have had 39 academic disciplines that participated in the GDR program, and they have focused on 53 research solutions. And I'm proud to say, with our gender justice issues, that 70% of our ASU GDR scholars are female in the scientific field.
Great,
So
thank
that's
you.
just a quick intro.
I'll be covering some slides about USAID. Just those who are not clear, Mohammed is a DBH graduate and the ASU USAID program manager who's led our students along with me. I'm more the PI. He's really the program manager of that entire process. So thanks for all your help, Mohammed, to date and in the future. Anybody else I missed? I think I covered everybody. Anybody else I missed so far?
Hi, yeah, this is Kim Poplar. I got skipped over.
Hi, Kim. Sorry.
That's okay. My background, I was active duty Air Force in flight medicine, and then I transitioned into public administration and nonprofit management. And then I decided I needed to go back to the DoD lifestyle. As a DoD civilian, I spent quite a bit of time as a group practice manager, HIPAA compliance officer, patient advocate. And then for the past year, I've been a quality management data analyst with the VA here in Sacramento, California. So I was mostly drawn to this global research opportunity just for further experience with statistical analysis and possibly even getting into grant writing, since it ties in with my nonprofit management background too.
Great, thank you. I see Tawfiq joined us. Go ahead, Tawfiq.
Hi, thanks for really, selecting me into this project, and I'm really excited. Sorry, I joined a little late. I missed most of your introductions. A little about me, I have, a little background in healthcare management, and I also have a background in finance. Currently, I'm working a full-time professional for the state of Minnesota as a healthcare policy analyst. And previously I worked also for the state of Arizona as a policy analyst. And I also have some background in a PhD program that I, started in Arizona, but did not complete it because of family problems that came unexpectedly, and I was, forced to withdraw from the program. But I have some of that research background where you do analysis and literature review and different types of research designs and statistical analysis. So I have some of that background. I'm drawn to this project, international research project, because I want to, benefit from your experience, as well as learn some of the grant writing skills. And one of my, hopes is to write, to publish a research article in a journal, one of the prestigious journals, or become one of the co-authors. That's really helpful. Even though I'm not, I don't aspire to be in academia, but I want to, really be recognized as a researcher, because that's one of my passions. And besides that, I want to apply some of the skills that I learned from here, or use it in, the country I'm originally from, which is in East Africa, Somalia. And there are a lot of similarities when it comes to global health issues that, most of Southeast Asia or in the Middle East and East Africa face. And, what I can learn from that, would like to apply that. And I also like to share my experience here as a professional, healthcare professional, as a doctoral student as well, be part of this great project. And I really appreciate, you selecting me into this program. And I look forward to working with you all.
Great, thank you, Tofi.
Thank you.
I'm going to share my screen and go over a PowerPoint slide, and we'll zoom through that. So again, welcome all of you for joining. I'm really impressed with how diverse this group is. The talent here sounds amazing. I'm really happy you all volunteered for this group. For all those who are in active duty or have served, thank you for your service. Greatly appreciated from all of us. So why study integrated behavioral health globally? What are the opportunities for you to be involved with this group? And our goal is to have some next steps at the end of this meeting. They're very clear. So this team was formed in 2018, and the goal is to provide all of you with any opportunities to do research with existing projects. Another goal is to help me, because this is a labor of love. Many of my projects, the USAID projects, they fund the students, their travel, their accommodations, their cost of living. There's no funding for my time. There's no funding for my global partners doing this all voluntarily. So I rely upon volunteer work now, with the goal, of course, of getting grant funding for more extensive and funded work for all of us who are involved in this. But I want to thank you for your help here. In this group, by the way, I know people are at different points in the program. There's no expectation of doing heavy lifting. If you just want to kind of observe and participate minimally, that's fine. If you want to step up and do something more major, I welcome that too, as long as you have the time for it, and we'll specify what your role could be. We typically meet monthly, but because we have so many projects that are coming up, I'm going to try and meet at least from now through November twice a month. And our goal is to form some subgroups. And I'll talk about that next. So why study integrated healthcare in Asia? And by the way, I'm focused on Asia because that's just luck of the draw, right? That's where the opportunity fell in my lap. But I'm open to having any of you with interest in places like Africa, Middle East, explore opportunities there. So we aren't limited. That's just where I began, and I'm spread pretty thin as it is. But we know globally there's a rise in obesity and chronic disease, and we know lifestyle conditions are underlying reason for those increases. And we also know that behavioral problems like depression, anxiety, trauma are all highly comorbid with the chronic conditions. And when you travel in Asia, you'll see, of course, all the different, fast food places, McDonald's and Pizza Hut, but you also see, on the one hand, fantastic grocery stores with rows and rows of fresh vegetables and fruits. Then you go to the restaurants and all those vegetables are cooked in oil and salt, and the benefits are suddenly gone. Alcohol is a big problem for men in Asia. And obesity is not as bad as in the United States, but it's a growing problem there, leading to more and more chronic disease. I'm not going to cover these more researchy slides in detail because we're too short a time, but just some quick research on global healthcare problems. There shouldn't be any surprises to any of you in the DBH program. And again, for me, the why of studying integrated healthcare in Asia, that was never part of my career path. I neither was DBH, but when I started traveling in Asia, I was just fascinated. As a psychologist, the need is so great. They have so many physicians and nurses who are overextended. They have relatively few behavioral health consultants or experts to help. And they recognize the need to address nutrition, physical activity, but they have no resources for that. So it's very clear there's a need to create a new workforce, whether it's social workers, community health workers, training existing physicians and nurses to begin doing the work you're all learning about in the DBH, either as clinicians or managers. So the opportunities, I'm going to fly through the opportunities, and then I want to save time at the end for discussion. So the first is the USAID GDR Global Development Research Scholar Program, every year from 2017 to the present, and we anticipate doing this in the future. We've had 3 or 4 or 5 students chosen every year. It's based upon USAID's investment in what Mohammed talked about, addressing sustainable development goals. These are the guiding principles. I'm not going to cover these in detail now, but just you have these slides. When we finish, I'll make slides available to all of you. And this is how it works. This is a nice slide from Mohammed. Do you want to just summarize briefly, Mohammed, if you're still there, how the program works in general, maybe 2 or 3 minutes, snapshot view?
Absolutely. So the slide that you see right now is the selection process. The way this program works in the past, the agency, the United States Agency for International Development, as you know, is the only sector of the government that is in charge of international aid for the United States. And they would usually collaborate with countries and either fund specific projects through the embassies. And the expectation was, here's the money, work on this project, let us know your objectives, and make sure that they're met at the end of the grant opportunity. There was no program that had scholarly exchange between institutions, between universities, higher education institutions, hospitals, and other sectors. And so Rajiv Shah, the former administrator of USAID under President Obama, had this initiative, which is the GDR program for us, GDR, that for the agency, it was the Research and Innovation Fellowship. The opportunity was extended to 6 American universities: Berkeley, Notre Dame, Rutgers University, Davis, and University of Chicago, and Arizona State, of course. And so we managed the Arizona State side, and USAID missions and embassies abroad were in charge of actually letting us know what research gaps they had. And once they identified those research gaps and articulated the needs and the specific steps, they would post those on a catalog that was curated by each embassy abroad. And then the catalog was also made open to these 6 selected universities. We would recruit the students, and students, based on their skills and expertise, would log on to the catalog, select a research opportunity that matches with their skills, and interact directly with the host partners, with the universities, with the hospitals, and other NGOs. And so that's how the exchange would be formed. We would prepare the students for the whole semester and then send them abroad. So in the picture, you would see 2 different arrows. One being for the potential follow, the red dots, how they would follow through this. And the blue solid dot is for the host partner. Host partner posts the opportunity, USAID mission reviews it, it's approved by the mission for its scientific impact, intellectual outcome, as well as its safety for scholars. Then, as I told you on the red side, the fellows review it. We vet the fellows, we send their names to the embassies, we get all the matches done, and then you'll see the little guy pulling the sack of money. Well, we don't give that much, but this is the process where they're funded, they go abroad, they connect both with the embassy as well as with the host institutions. The fellows continue to communicate with their host partners, continue to engage with the embassies and other sectors in those countries. And the goal is to really expand and create a research environment that really speaks to the needs of the host institution, not ones that we impose on them. The basis for the opportunity and this idea was the global gap in research, where 25% of the world's population is actually writing and doing research for 75% of the world's population. So there was a disparity in who writes research and who does research. And so this was in a way to democratize research and the scientific field. These are our global goals, and so far, as I had mentioned earlier, we've met them. The idea that these goals are not just the 17 goals, but they're sub-goals that each of these goals certify. The picture right here is from one of our scholars in the global health, Sarah, who came from ASU's global health program. She worked on TB stigma prevention program in Indonesia, where she worked with religious groups to help dispel some of those stigmas so we can overcome the impact of TB. She's done an incredible job and moved on to do more international development work.
Great. Thanks, Mohammed.
You're welcome.
So the first 3 years, we did the same study over and over again in different sites. And the study involved really 3 key components. Identifying a hospital or a primary care clinic or more than one, administering the practice integration profile, the PIP. That's a measure of clinic integration developed by our faculty, Dr. Roger Kessler. So how much is the clinic integrated percentage-wise on 6 different domains? We administered a survey to the clinicians, mostly physicians and nurses, that had about 20 different common behavioral problems, both lifestyle and behavioral, and asked the physicians to rate how prevalent they were, and also to rate, if you had a behavioral consultant, how important it would be to have that kind of person to help you with these problems. So we wanted to get the provider's point of view about integrated care. Then we selected for patients who had diagnosed diabetes or hypertension, have them complete a patient self-report health risk assessment, a short questionnaire largely based upon one report called My Own Health Report you may be familiar with, an online survey with brief questions about nutrition, physical activity, sleep, the PHQ-4 for depression, anxiety, etc. So we wanted to really evaluate all the different domains to create an assessment and show here's the need for integrated healthcare in these countries. We expect to see low integration, expect to see high demand by clinicians for this kind of service, and of course expect to see elevated health risks for the patients. And we largely found those patterns to some more or less in our research over those 3 years. We also really want to try to encourage all of our sites to embrace integrated behavioral health and ideally find their own local resources, whether it's through the hospital leadership, the Ministry of Health, to help support adding more resources and extending these programs after our research ends. Here are our partners to date in the USAID program. I'm not going to read these out. You can just see we've been in China, Thailand, Cambodia, and Vietnam. These are the kind of questions we were asking about each site. This is just an example of, this is a kind of a dated snapshot, but it shows you the different tools we measured, we administered. It shows you for some of the sites, how many HRAs we collected, how many provider surveys, how many PIPs were done. So the results, first of all, I want to give a big thanks to Jen Rolfs, who's on the call. She mentioned she really put together our data analysis. She single-handedly put together our Excel and then SPSS and other kind of data formatting for all this research data. And it was a huge amount of data. And also, this was a project that was done, again, on the fly without resources. We often found one version of the questionnaire was used 1 year on one site, and after the second year, there were a couple questions missing, so there were data integrity problems. It's still great research and great data, but it wasn't airtight. So there was many problems Jen had to iron out. I want to give you a big thanks, Jen, for all your work on the data to date, and it's still going forward. So we had
You know
data.
me, I do love data.
Yep. More of your brethren on this call, so we're going to take advantage of all those data junkies and put you to use here.
I am super excited that there's people besides me that are excited about data. So you just email me and we'll get you going.
I'll cover the results of our study at a later time, but just to give you a level of what we're doing production-wise, we've submitted for review an overall paper describing the project the first 3 years. We submitted an individual paper for the results from Chiang Mai, Thailand. It was 2 years. And we're about to submit a paper for Hanoi, Vietnam from last year. On deck, meaning we have data ready to be analyzed and put together papers, individual papers for 2 years of data in Cambodia, 2 years of data from Ho Chi Minh City, 1 year from Beijing, and 1 year from Bangkok. So this is opportunities for any of you who want to do research. We have a kind of a template to follow. Here's the data, let's analyze it, let's report it, let's write it up in terms of literature review, the results, and go from there. These are all opportunities coming up. This year, with our 3 students, we didn't want to repeat the same study again, so we put together a Train the Trainer program. We had 3 students working with 4 sites: the National Cancer Hospital in Hanoi, our former partner from 2017 and 18, Ho Chi Minh City University of Medicine and Pharmacy, the Ministry of Health in Phnom Penh again, and Chiang Mai University Faculty of Nursing. So these are the 4 sites we're going to be doing Train the Trainer on. We're going to try and pick out one or more key clinicians, train them to train other clinicians to deliver interventions for the patients in these sites. In the training topics, this is a really small grant, just enough funding to do some basic work. Our hope is to do this training, create both in-person and recorded training modules, and then look for other grants to extend this work to more clinicians and actually test the impact on patients. But for the first phase of this project this year, we're going to train the 5 A's, an approach for doing assessment, patient engagement, and treatment planning, motivational interviewing, behavior activation for depression, and nutrition behavior change. Those are our 4 key topics. We're in the midst of that right now. If you have expertise in any one of these 4 topics or more than one, I'd welcome you stepping up in our next phase of this group to identify yourselves and offer some help to our existing students. For 2021, we do plan to continue this program again and ideally add new partners. I've had colleagues in India, Indonesia, Malaysia, and the Philippines who want to join this effort, as well as keep some of the old partners. So that's our goal, is to expand our breadth and scope. And hopefully, we can find grant support for our past partners, get new partners on through USAID, and then overall have more and more grant funding come in and help support this spread globally. And again, if for all of you with interest in other countries, happy to add to this list down the road. Other opportunities include a grant I'm working on right now from the College of Health Solutions. It's called the Jumpstart Grant. This grant was to validate the practice integration profiles. So we use the practice integration profile, but you saw it wasn't administered very often. And some of the things like the clinician, the provider survey and the patient HRA, those are pretty clearly and easily translated, but the practice integration profile has many terms that are not necessarily familiar to clinicians and leaders in Asia. So we wanted to take time to we use a focus group approach and have a small number of clinicians go over this with a fine-tooth comb, identify translation problems in Thailand, Cambodia, and Vietnam, make a revised version in consultation with the US PIP team to make sure we keep fidelity with their intention for all the questions. And then give it to a larger number of clinicians, maybe 20 or so clinicians per site, and do a small validation study. There'll be some problems because you need to have a very large sample size for a true validation study, but at least be a step in the right direction and still good results for us to further say, yes, we're using the PIP. It makes sense to keep on using these countries given this research. So there's a need for help on this project. I also have a Institute for Social Studies research grant this year. And this is working with the University of Labor and Social Affairs in Hanoi, the School of Social Work. And the goal is to develop a curriculum for integrated behavioral health for social workers. The curriculum, we have the topics. We aren't quite sure the final form. Will it be some existing online modules that are part of their current curriculum? Will it be new classes added? Will it be an entirely new degree? That's to be determined as we go through our work here. But at the very least, it'll be a pretty comprehensive curriculum with modules to cover the topics I just showed you, and as well as additional topics for the social workers in Vietnam. I met through social media a new colleague, a social worker in India. This is his university. And I shared the Train the Trainer project with them. Even though they are not funded, they're very interested in integrating behavioral health in their settings. And we're at the very early stages now working with them to take our Train the Trainer modules we developed for the Jumpstart or the seed grant funding and USAID funding and apply it to their faculty and students in India. So a new project I'm very excited about. I should also add, I missed one slide. I also have one more paper planned I could use help on for China. I have a colleague in the CDC in Guangzhou, China, that's really a long-standing proponent of integrated behavioral health in China. She's finding difficulty getting buy-in from really the government and hospital officials there. She's asked me to help write a paper with her on integrated behavioral health in China to help gain visibility and momentum for integrated behavioral health in China. So I'm working on that paper in the next few months. Anyone wants to help on that, I can welcome some help on that paper also. Now, new grant applications. The last 3 or 4 years, we applied for 3 or 4 grants a year, mostly the Forward International Center, which is tied to NIH. And the grants are extremely complex, difficult to write, very competitive, very challenging. So we've not been awarded any grants yet, and that's not unusual. Many people have to go through a cycle of putting together teams, applying, getting feedback, what to improve. We're in that stage right now. This year, I intentionally did not apply for grants because I was advised by my mentors this should be a time to work on publishing our USAID papers, because if you have papers published relative to the grants you're applying for, it increases your odds of being selected. So we're winding down that process now, but I do want to try and apply for a couple of grants this year as the year winds down. The first one is this study of non-communicable diseases and disorders across the lifespan. I left the URL if you want to look at this yourself and review it. It's basically a grant to establish over the course of 5 years research on chronic disease, non-communicable disease in low-middle income countries. So the countries I'm working in right now are all perfectly qualified for meeting the criteria. And we've been doing this already. We've been developing, research teams in these countries already for 3 or 4 years. This would be a way to get much more significant funding to help extend that work and really establish them as researchers, having them trained by ASU on things like dissemination, implementation, science, et cetera, and use that to actually do maybe one small clinical trial as part of this project. So we're planning to apply for this. I'm still waiting for final go on this one, but we'll need help on this big time. And in terms of asking for help, this is one of our highest priorities, but I'll just make clear, there'll be chances for all of you to participate. On this priority, our priority is students who have experience doing grant writing, experience in research design, statistical analysis, and who are excellent writers in terms of literature reviews and method sections. So there'll be a chance to really do a little application for those who are going to be included in this project. Be very quick though. It's going to start literally this week into next week, and the grant is due November 13th, I believe. So it'll be a very intensive short-term project. The next is a USAID larger grant called DIV, for Development Innovation Ventures. This is a smaller grant, but it's much bigger than our current student grant funding for the GDR program. This is to fund innovative programs that are especially technology focused. So our goal is to apply for this. It's really a 3-phase grant. The first phase is very, very small, but to use our partners in Asia and take the HRA we put together on paper and pencil and develop that with an app-based version we can use and extend that with community health workers or nurses, encouraging patients to use that app to assess their health risk and offer treatment suggestions to them. This past year, I took on...
Just to add, sorry, Ron. Yeah, just to add on the DIV venture, Development Innovation Venture grant offered by USAID. So there is about 3 stages to that grant. There is a proof of concept for $200,000. There is testing and positioning of scale for up to 1.5 million, and there is scaling up to 5 million, and then evidence grant, which is 15 million. So there's quite a bit of money there. The process to it is incredibly tenuous and requires a lot of attention. And we have had several meetings, and I think hopefully early next year we should be able to take advantage of this process, especially given that we have several of our research already posted with the DEC, which is the USAID electronic distribution center for all research.
Thanks, Mohammed. Last of all, I volunteered this past year to be the committee lead for the DBH Annual Integrated Healthcare Conference. It's typically in the spring in person. We had to obviously cancel that in person for this past spring. We did an online version. We're going to do an online version again for next spring. But we're also going to do a separate global integrated health conference. And we expect to be able to present the results of our current research, including our students presenting and inviting our colleagues globally to join us. We'll do a morning conference. We can have them join us in their evening time there and really present our results and maybe include some other colleagues that might have met along the road to make my vision is to make ASU DBH a real hub for global integrated health research. We're already doing a great job in terms of our current vision, which is to educate, train clinicians and managers in integrated behavioral health. We had a number of global students, but I want to make this much more of a hub, meaning we'll do research together, we'll do student-faculty exchange, we'll do conferences where we have global scholars come here and we have our scholars go there, students and scholars, student exchange programs. So that's my hope for this program. That's why I'm doing all this work, and that's why I'm looking for your help on these projects.
Dr. O'Donnell, can I add one thing in?
Yes.
So I think that the priority for the grant that's due November 13th, as we talked about yesterday, was not only just the writing of like the body of the narrative and everything, but also we need at least, what, 3 people who can volunteer to get all the paperwork together for each country that we're engaging with, which is really like bio sketches, letters of support, like different site information, so that they can be considered subrecipients of the award. So I would say that that's top priority, and we can send you the documents that need to be filled out, which one should happen first, the appropriate contacts. And that's really more like wrangling people who are super busy, like we all are, right? And getting them to complete the documentation in, you know, a reasonable amount of time so we can get that all consolidated. Otherwise, we just can't even apply for the grant if we don't have all these things for the subrecipients. Did I say that in a correct, reasonable way?
Yep.
Well, I can, this is Eating. I can help with that if you need.
That would be awesome. And I was telling Dr. O'Donnell actually yesterday when we were talking about this, I was like, is Eating going to be involved? Because she was so great last time. And I was at a complete loss for what I had to do because I was coming into it really late. So yes, that would be awesome. I think, and Dr. O'Donnell, correct me if I'm wrong, that it's Thailand, Vietnam, Cambodia.
Yeah, that's our current plan.
And I can't remember, is this the one that Singapore might also be involved in? So we need some information from them as well.
A quick background, our grants we've done in the past have all been similar. And that's one of the good things. We have existing literature review, existing designs we can just kind of quickly massage for these new proposals, both the USAID DIV and for this other global grant. But there's still substantial work, you know, they're so competitive. Writing is critical, and we need expert writing to make sure we're really selling this grant, right? And our project has been combining health technology with integrated behavioral health. We've had 2 partners. One, Professor Matt Booman in ASU Council Health Solutions has developed a smartphone app called BeWell24, which has been validated and proven effective with the veterans population in the United States. And it's an app that covers domains you're familiar with from common apps. It covers physical activity, sleep, sedentary behavior, and nutrition. And we also have a colleague I met, a professor who's from China but works for National University of Singapore, Wenru Wang. She developed a smartphone app for type 2 diabetes. And that app included like a patient clinician portal. So our goal is to combine the BeWell24, which is also based upon the Fitbit, and the app from Wenru. We also had National University of Singapore expertise in artificial intelligence, and the goal is to add that to our app functionality. So we're meeting with that group again now on this grant, and ideally we'll have the combined technology from Matt Blumen Singapore to develop research teams in Thailand, Cambodia, and Vietnam. So it's a pretty complex grant, but the funding is decent, and we already have willing partners and a track record of working together. So, but Jen's point, if you have never done an NIH grant, it's hard to describe how much detailed work is involved and how much quality is required. It's tremendous. And, you know, all of us, we're doing this on top of our full-time jobs. My main responsibility is teaching all of you in my classes. That's my first priority. So I can't suddenly not do a class or grading and run up on this project. So we're working crazy hours to make this happen. And I need help from students like you and graduates who can really help pick up the effort and help us get this done, because it's extremely complex and challenging work.
Yeah, and Dr. O'Donnell, would you say then that if we had like one point person for each of the partners to fill out the kind of 3 or 4 required documents over the next few weeks, that would be ideal? And then of course we need, you know, half a dozen at least plus people to help us with different aspects of the actual grant narrative and everything.
That makes sense. I'll cover that at the end of our talk today, how to do that.
Oh, okay, sorry. Am I jumping ahead?
No, you're doing fine. Good detail. Because it is the most important part right now.
Okay.
We have tons of opportunities here, as you can see, and there's no rush. But for this, we want to be very focused and find a handful of students who can make the time over the next 4 weeks to get this done. Last of all, I do have approved a study abroad program for next year. ASU has a study abroad program they do every year where they have students who are interested apply and pay for this program and go study abroad for typically 2 or 3 weeks. They get 3 credits, 3 or 6 credits, depends on the function, the amount of work involved. So this is, of course, pending COVID-19 being resolved, but I'll be doing this next summer. And this is open to all students in ASU, it's not just DBH. It's expensive. It's typically at between $4,000 and $5,000, so it's something that's going to be limiting for those who have not got the cash to spare. And if you're a DBH student, that's going to mean many of you. But for students who want to spend 2 weeks visiting Chiang Mai, Thailand, and Hanoi, Vietnam, it combines both meeting all of the colleagues I developed over time, learning to take care in those countries, but also doing, you know, cultural immersion, visiting different historical sites, tourist sites. So it's a combination of work and relaxation. That should be a blast as long as we have COVID-19 tamed by next June. Keep our fingers crossed for that. So next steps. I'll have Jen refresh our Google Drive we already established for this project. I'd like to have at least one student who's familiar with using Google Docs step up to help me develop some folders for this group. And in particular, I want to have an Excel spreadsheet put together by one of you. It simply has a place for the student to put their name, their degree, areas of expertise, clinical, their interest geographically, if they have any interest in a certain country, for example, and then some way of looking at competencies. Statistics, grant writing, literature review, graphics. I forgot to add project management. Project management is critical. You know, herding cats is a big part of what we do. So anyone who's a good project manager. So I have a chance to have you kind of maybe rate your competencies in these and interests. We can begin more formally sifting through who wants to do what where. But back to Jen's point, I do want people who are interested, just email me if you're interested in that upcoming NCD grant to work on that. And I'll talk to you offline. If we have many students who step up for that, I'll probably find some way of just looking for ways to assess your competency, maybe give me an example of your writing or something like that, just so I can assess quickly who the best people are. We don't want to have too many people and it gets too crowded, and that can actually be a detriment. But I think we need to have, as Jen said, at least one key project manager to work with each of our 3 sites. Maybe one project manager overseeing the entire project to keep track of things under my oversight. We could use another research design statistician. We could use an excellent writer for grant writing. If anybody has experience doing graphics or PDFs, making tables, things like that, those things are also helpful. So I'm not going to ask for names right now because it would be too much. There's too much to go over in too little time. I want to give you a heads up what's going to happen next. But for now, if you're interested in that upcoming grant, email me personally and we'll take it from there.
Dr. O'Donnell, I just have one thought on streamlining it, only because what we've been doing at CHU is using Microsoft Forms to gather like survey responses, and I'm happy to build a survey and send the link out to everybody, and they can just fill it out, and it essentially collects it on the back end in an Excel spreadsheet where we can get all the information that we need, and everybody just fills out a survey when they have time instead of all the emails going back and forth. Do you think that would be more efficient?
I think both.
Okay.
I want to find out quickly who's interested, so you can really email me tonight if you're really interested in that grant. But,
okay.
I always, lecture in my courses. A good leader knows when to listen to anybody else in the team who has a great idea and say, yes, please do that. So yes, Jen, please do the forms.
Yeah, I just think it's a good way to gather. But yes, if anybody's super excited, please email Dr. O'Donnell. But otherwise, as you have time, and I can make it tonight, over the next few days, please let us know what your interests are, short-term and long-term. And that way we just have a repository as well, so that we can pull resources as needed. I think would be easier than searching email all the time. But
yeah, I agree.
I defer to you.
No, we want to do both. We want to be organized for the long haul. There's no rush. With this one project, there is a rush. That's why I want to make sure I fast track this
Absolutely.
one.
I totally get it. So I'll send that out tonight.
Yep. Thank you. So I'll be looking to form subgroups on these different priorities, both the USAID publications, the USAID DIV grant, Jumpstart grant, the SEED grant, the India project, the China paper. So just give some thought to what your interests are, what your skills and competencies are. And we'll, I think by next few days, put together and open up our Google Drive, the form Jen's talking about, and I'll begin working with a small team on that grant, as well as all the interests you all have overall. We have like 10 minutes. I just want to stop, open up for discussion. Let me stop sharing my screen here. I covered a lot of ground there. So we've done a lot of work. It's very impressive. And every year it's kind of exponentially building. I really think we're on the verge of getting some larger grant funding. That's the way things are going. I want to give special thanks to Jen for statistics, to my colleague Shiyu, who I met, and who's been great for helping us review our papers for publication. All the rest of you have been helping me in different ways. Our former USAID students, Mohammed for USAID, big thanks to your ongoing work. Mohammed and I, just a quick story, we used to interview students for the DBH enrollment. So I interviewed Mohammed. He told me about this USAID program he was running. And I thinking, oh, this would be great. So after about a year, I looped back to him, and that led to this whole program starting. And we worked together while he was finishing his DBH. And I can't tell you how many challenges there are in this kind of work. It's extremely challenging, stressful. It's not easy stuff. So I don't want to give you the impression it is. It really is hard work. And if you do volunteer, keep that in mind. There'll be expectations that are high. And if you can't do it now, you can always, like I said, hold off and just observe and learn and be involved later on. Those who are graduating, if you want to be involved as a graduate, that's certainly okay too, to stay on this group. We have several of our DBH graduates on this right now. So I'll stop there, and let me just take any questions or comments from you for the last 7 minutes here.
Hey, Dr. O'Donnell, this is Pearl Duran. I'm very interested on that NIH. I'm hopefully looking to work with Jen as well under the data statistical area. I'm also previously a data management. So under her tutelage, I would love to be able to learn all those little things as well for grant writing.
You sound great for this, Pearl. I'm glad you stepped up.
I actually had, sorry, Dr. O'Donnell, I actually had a question about the different integrations that we were talking about a little bit earlier.
Mm-hmm.
So will our primary locations be the three ones that you listed, like in Thailand and Cambodia? So will we use that model that we use for the different research in China and the other countries that we used last year, and then try to modernize it to this year?
Now, our goal is to move beyond that. We might do some select research on those existing 3 questionnaires, but our goal now is to be moving beyond. That's more of an assessment phase, right? And we want to do actual implementation training now, of training and studying the effects of training in these different countries. If we start a new country, we might do some of those surveys again just to get a sense of the baseline there. But for our existing countries and partners, we want to try and move beyond what we've already done. And the topics are wide open. Integrated healthcare is the overall topic, but it'll vary based upon the grants, that our partners' interest and the students' interest.
Great, thank you.
You're welcome. In terms of your direct experience, there'll be a chance for those who are involved to actually join meetings, Zoom meetings right now with all these different partners globally, working with them, maybe with their assistants to implement research. You'll be eligible certainly to apply for USAID slots for next year as part of this group. And certainly this experience will be a plus if you do apply for the USAID GDR program next summer. Again, pending COVID. So there'll be actually chances to study abroad either virtually, on Zoom, or in person if that's an interest you have and the opportunity presents itself through our either grants or USAID.
Dr. O'Donnell, it's 18. I can be the PM.
That'd be great. Thank you.
Welcome.
I had the fun of meeting Yi Ting and her family last year in Boston. Went out to a fantastic hot pot restaurant and shared wonderful hot pot together.
And my daughter is actually at the New England right now.
Yep.
We love hot pot over here too, because my husband's from Singapore and is ethnically Chinese. So we have definitely had our hot pot moments.
Yep. That's a side benefit for me. I love all food globally, and Asia's no exception. So it's rare for me to turn anything down when I
Dr. Donald, I'm sorry, I had another question.
Mm-hmm.
So would it be important for us to at least have a basic understanding of like the different languages that will be utilized in the countries that we're researching?
No.
Okay.
No, really, we go through a little bit of a cultural understanding. Hold on, let me fix my audio.
It's working fine, Mohammed. We hear you.
Yeah, so through the GDR program, the Global Development Research Program, we have a pre-departure training, or in this 2020 year, it was just training to understand a little bit of a project management, as well as the international development discourse, and a little bit of a cultural understanding into each of the all partner countries. We're not cultural experts, but what we have strength in is to put on that critical discourse analysis in terms of what development has done historically, and just go away from the colonial mentality of we're doing research for them. We're not doing research for anyone. We're collaborating with partners and together enhancing the collective global health goals, which is why we benchmark with the SDGs. So that's the strength, I believe, in the program. Culturally, throughout the GDR program, there were some countries that expected linguistic ability, especially in that particular country. But with our healthcare program with Southeast Asia, that was not the case. I'm not telling you just because you speak English, you're going to be fine and just go anywhere you want. It's going to be very difficult, especially if you're immersed in that country and in the host partner. But most of our students, and some are actually online right now, were able to manage to be in country, develop their project, and work with our partners without language being required. I can't say language is not a barrier. I think Christina can attest to that, but they all had incredible time and enjoyed it.
I've got to wind the meeting down now because I've got a meeting in 1 minute with my colleagues in Hanoi. So I'm going to have this meeting held again in 2 weeks at 6 p.m. Arizona time for 1 hour rather than the hour-and-a-half meeting. I'll have, as part of Jen's work, like a poll of other meeting days and times. I prefer a daytime meeting because I have so many meetings at night right now with my colleagues globally, but if we have to do night, I will. If we can find a daytime time that's better, that'd be great. So we'll kind of just do a poll and figure out the best time. But for now, we'll keep this 6 p.m. Arizona time for 2 weeks from now. I'll do an invite for that next. Thank
Dr.
you all.
O'Donnell?
Yes.
Sorry, one more thing. I can go to the Singapore meeting tomorrow night now because I had to delay my trip because my kitty's sick. So if you want to add me back to that.
Which one is that? Oh, tomorrow. Okay.
Aren't we meeting with the Singapore folks tomorrow?
Yeah, you're in that meeting already. I didn't take you off, so you're in.
Oh, okay. I know I declined it, so I'll see if I can re-accept it.
Resend.
If not, I'll let you know.
All right, thanks all for your great.
Dr. O'Donnell, quick question.
Okay, Florence.
Yeah, is that meeting that I'm involved, is it tonight or tomorrow morning at 9 o'clock?
Tomorrow morning at 9.
Oh, thank you. Oh, you scared me. Okay, good night.
Like crazy globally, you guys. These are examples, keeping track of all these meetings. But you'll be involved in this soon. Look forward to having you all help out. I really appreciate your volunteering. And this should be a fun experience for all of you. Hard work, but fun.
Thank you, Dr. O'Donnell. Appreciate
Thank you. Good night.
Thank you, everyone.
Thank you. Bye. Bye, guys.